Hi everyone, my name is Krupa and I'm a consultant nutritionist at Pramea Health Private Limited. Today I'm going to talk about some of the hydration tips while you're undergoing chemotherapy. Chemotherapy could have side effects because it is an intensive treatment of cancer. The side effects could vary from fatigue, sometimes it's an infection, sometimes it is anemia too. So, the gastrointestinal disturbances could be nausea and vomiting, sometimes it could be constipation. But the key is to practice hydration methods when you are dealing with all these symptoms or side effects. Because it is summer, it is even more important for you to keep yourself hydrated all through the season. So let's go ahead and discuss what you can actually do to keep yourself hydrated. Or is it only water which you can use for hydration? So let's see. Point number one is yes, water is the best option when you want to keep yourself hydrated. But then you can actually go ahead and experiment with the flavoring of your water. For example, you can use something called an infuser bottle, which you can through which you can flavor your water. Here, what I've done is into my infuser bottle, I've added a few pieces of lemon. So the flavor of the water changes, and the monotony of drinking only water throughout the day is broken. You can go ahead and experiment with a few pieces of cinnamon sticks, which is equally refreshing. Some people could even like pudina flavor, so you can actually add a few splits of pudina into your infuser bottle and keep sipping that water throughout the day. Let's say if you are aiming at 2 bottles of water, 3 bottles of water, then definitely there is scope for experimentation. Next is you can actually keep a tray of ice, and you could add a few pieces of fruit of your choice. It could be muskmelon, it could be again pudina or any flavoring which you like. It could be grapes because the grapes are in season. It could be zests of orange peels. So you can actually freeze them in an ice tray and then use it as popsicles. Especially people who have got mouth sores will definitely benefit from it. So these are the tips what you can do with water. Next, we will go on to watery foods. What are watery foods? When I say watery foods, it could be milk, juices, soups, fruit smoothies. All these come under watery foods. These have got 95 to 98% of water. Definitely benefit from eating or consuming these. So what can we do when it comes to watery foods? You can actually make, there are umpteen number of soup recipes available on the internet. The cucumber soups, the tomato soups, adding a little bit of potato into your soup will actually add bulk and makes the soup thicken. So these are the things you can actually make. If you prefer warm foods, it is soups. If you want cooler foods wherein you can avoid odors which will make you nauseated, you can actually go in for cool foods. I would strongly recommend fruit smoothies. Now, the baseline is you will have to entirely or completely clean the fruit before you use it. I'm sure you will all be doing the same. So these are the options when we are talking about watery foods. Then we can actually go ahead and talk about milk and flavored curd. So flavored curd, a thick dal, these are the things which will actually come under protein foods, which will help you heal, which will tide you through the chemotherapy phase. So you can actually flavor your curd with any fruit which is of your choice. Mangoes are in season, grapes are in season. You can actually make a slurry of these fruit, add it into your bowl of curd, make your yogurt or curd even more interesting. It could in itself become a meal. So this is about milk and milk products. Then we go on to mild teas. There are several flavors which you can try. A ginger tea might be very appealing to some. You could actually make teas with cinnamon sticks, and lemon tea is also a very refreshing drink. But make sure the teas are not very hot, neither are they cold, because if they're hot, they can actually irritate your oral cavity and worsen your mouth sores and other coexisting conditions. The next best option is to make juices. Now you will have to be careful. I am emphasizing the cleanliness of the utensils here, and also the fruit and the vegetable which you are using. It need not be a fruit juice all the time. Tomatoes, the carrots can be made into juices. Beetroot, which contain a lot of antioxidants, can be made into a juice. Cucumbers can be made into a juice. You can actually go ahead and add a little bit of sugar and also some salt so that the electrolyte balance is achieved. These are the things which you can do under fruit and the vegetable juices. Now, when we're talking about all these, I will also give you 3 golden rules when you're doing all these, because during chemotherapy, there is some amount of immune compromise. The immunity is reduced. I would strongly suggest that you make these at home because you have better control over the cleanliness there. Number 1, for all these things, the water is boiled and cooled. Whatever food preparation or the fluid preparation you do has to be made with the boiled and cooled water, which is made at home. Always carry a bottle of water with you. Never depend on the outside sources for your water. And number 2 is the strainers, the straws, the utensils which you use for making all these fluids and juices has to be thoroughly cleaned. If you're already doing it, then you take a step ahead and make sure your filters are clean, your utensils are sanitized and all that. The third one, and very important, is the fruit juices and the vegetable juices have to be consumed fresh, because the sediment, if you keep it refrigerated and if you postpone consuming it, there could also be development of off odors, and you might not like whatever the juice or the preparation which you have made. Cleanliness is of utmost importance during chemotherapy. Most of the times we say that thick skinned fruits, muskmelon, pineapple, watermelon, these are the things which have thick peels, therefore are less susceptible for bacterial infections and therefore are safe for consumption during chemotherapy. I hope I have given you a few practical tips to hydrate yourself during chemotherapy, and also I would like to end this video with a positive note. We call it side effects, which means they will fade away. You will be relieved of these symptoms within a few weeks of your chemotherapy. It might be very hard and difficult during chemotherapy to even look at food, but if you have the positive attitude that the food which you eat or drink is going to help you heal, then I think the food therapy or the nutrition itself as a therapy will work better. Thank you so much.